Have you ever pondered over the current state of healthcare? Is it as comprehensive, inclusive, and effective as it could be? Or is there room for improvement? Imagine you're a car mechanic. A customer walks into your shop, describing a strange noise their car has been making. The customer isn't a mechanic, but they know their car. They've been driving it every day. They know its quirks and peculiarities, and they can tell when something's not right. As a mechanic, you would listen attentively, wouldn't you? You wouldn't dismiss the customer's concerns or question their experience. Instead, you would use their insight as a valuable tool for diagnosing the problem. Now let's translate this scenario into the world of healthcare. Picture a patient walking into a doctor's office describing the symptoms they've been experiencing. The patient isn't a doctor, but they know their body. They've been living in it every day, they know its quirks and peculiarities, and they can tell when something's not right. Shouldn't the doctor, like the mechanic, listen attentively? Shouldn't they value the patient's insight as a crucial tool for diagnosis? In an ideal world, the answer to these questions would be a resounding yes. However, the reality is often different. All too often, the dialogue between doctor and patient is not as open and inclusive as it could be. Too often, doctors question patients' experiences rather than valuing them as crucial sources of information. The best possible diagnosis doesn't come from test results alone. If it did, how did doctors diagnose illnesses 150 years ago without today's advanced testing methods? They did it by talking, asking questions, and listening, just like a car mechanic. It's time for us to acknowledge the value of other countries' research, testing methods, interpretation of test results, and work practices, even if we haven't researched them in our own country. Knowledge from other countries must be valued. We need to advocate for better healthcare practices. We need to insist on a more open and inclusive dialogue between doctors and patients. We need to demand that doctors value patients' experiences and insights as crucial diagnostic tools. So, the next time you find yourself in a doctor's office, remember that you're not just a patient. You're an expert on your own body, and your insights are valuable. Don't be afraid to speak up, because advocating for better healthcare practices starts with you.